Hello, I am Sarah Gallant, one of the speech therapists here at the ALS Clinic at the University of Utah. This is a talk about augmentative and alternative communication. So within the diagnosis of ALS, speech many times can become difficult to produce clearly. Your speech can become slurred and can become difficult for other people to understand what you're saying. We call this change in speech dysarthria. When verbal communication is no longer an effective way to communicate with others, it's important to consider an alternative way of communicating with your friends and family. One option is an alphabet board. This is just maybe a piece of paper or a larger board that has letters on it. Some people also will add phrases. And they can be used with just pointing with your hand or your finger to a particular letter. You can also use it in conjunction with a laser pointer that you attach to maybe the side of your glasses or a visor on a hat. And then you can just use some small movements of your head to scan with the laser pointer to particular letters. Some people also get really adept with these and can use just their eyes to move to particular letters with a caregiver who also is familiar with the board. So an alphabet board can be used just with scanning to each letter and spelling out an entire word. Other people can use it just to point to the first letter within each word. Sometimes that is enough for whoever you are talking with to understand what it is that you're saying. Alphabet boards can be found online. There are some websites that I've included. You can also just ask your speech therapist the next time you're in at your ALS appointment, and we can give you one as well, or direct you to some other examples of alphabet boards that might be helpful. Another option is a boogie board. A boogie board is a tablet that you can write on and makes writing much more efficient rather than carrying around a big tablet of paper and a pen. A boogie board can be cleared after each message. So you can write out a message and then just hit the button when you're done and it will clear the screen for you so that you can write out your next message. It's a really efficient and good option for people whose hands are still working well enough that your handwriting is legible for face-to-face interactions. So for more distant interactions, say talking over the phone or with someone who can't see your writing, another option are apps that you can download onto a phone, a tablet, or an iPad. Some of the apps that I like and recommend are Speech Assistant AAC. It's about $15, and it has means for programming in phrases or words that you use on a regular basis. And then it also has a keyboard so that you can write in new or novel words and phrases as well. Speak For Me is a text-to-speech app that costs 99 cents. And that's a nice program for just typing in a message and then hitting the speak button, and your phone or tablet will produce that word or phrase for you. Predictable AAC is an app that is much more expensive. It's $160, but it has lots of different functions on it, and it can also connect with your phone so that you can type out your whole message within the Predictable app, and then that message will be produced through the phone. So you can actually have a phone conversation with someone using that app. The last level of communication devices are eye gaze devices, and these are great for someone who has lost coordination or strength in their hands or fingers to be able to access a touch screen. And an eye gaze device actually uses your eyes to access the screen and to make selections. So if you're curious about these kinds of devices, the Tobii Dynavox website is a really great one to see all the different kinds of devices and see some examples of how they work as well. If you're interested in an eye gaze device, there is a process to access one. A formal evaluation needs to be completed by a speech-language pathologist, and that is to determine what device is the most appropriate for you based on how you will be using the device and all the different functions that you would like to have. It's also important to have that report that then gets submitted to your insurance company in order to pay for the device. Since they're expensive, you certainly want that to be paid for. If you have any other questions about an eye gaze device, please ask your speech pathologist at your next appointment.